proposed the more general proposition that if a response inhibitory to anxiety can be made to occur in the presence of anxiety-provoking stimuli, the bond between these stimuli and the anxiety will be weakened. We interpret this by saying two variables can't exist in one solution. The rat can't eat food and have this irrational fear of a cat. It's one or the other. This hypothesis changed the way psychologists studied phobias.
The reason the study was done was because the treatment of phobias, chronic irrational fear of a stimulus, widely relied on the Freudian concept of psychoanalysis, in which the expected outcome of realizing one's fear or cause of phobia causes the person to rationalize their fear and no longer have them. However, despite this in clinical practices, those who came to understand the reasoning behind their phobias still maintained them. Joseph Wolpe, while not the initial person to suggest the use of systematic desensitization technique, is known to be one of the ones who perfected it as an alternative treatment of phobias instead of the one previously used.
If you were to seek psychotherapy from Joseph Wolpe or another behavioral therapist, these are the following three methods that I will be describing that would normally occur during a therapy session. So the first method is relaxation training. Its purpose is to fully relax your body, not focusing, thinking, or talking about your phobia at all. And it usually takes several sessions for you to fully relax. So overall, you are tensing and relaxing in different groups of your muscles in your body. So examples would be arms, hands, face, back, stomach, legs, etc. Hypnosis is another option that might be used during this method, but it isn't necessary to achieve a full relaxation state. The second method is the construction of an anxiety hierarchy. What is that, you may ask? So basically, it's a list that you would make with your therapist that consists of anxiety-producing situations or scenes involving your phobia. And you would start it off from slightly uncomfortable going up to the most anxiety-producing event. Examples being walking over a sturdy bridge as the least uncomfortable situation to occur to you, to standing at the edge of an observation platform of the Empire State Building as the most anxiety-producing event. Third method is desensitization. So basically, what's supposed to happen during this method is to help you stop associating certain situations with your phobia. You would first put yourself in a full state of relaxation. There's a reason why we start off with that as the first method you go through. Then your therapist would slowly go through your list of anxiety-inducing situations, starting from the slightly uncomfortable and then going up. And if you're anxious at all, you would have to tell your therapist and they would stop until you've returned to a full state of relaxation again. If it continues that you're able to go through your entire anxiety hierarchy without becoming anxious, then you fully completed and gotten over your phobia. The average sessions would be around 12, but it would range from 6 to 100 sessions, just depending on the person.
It was discovered through earlier research done by Wolpe and other people that a very simple conditioning procedure could be administered to animals to help reduce their fear reactions. Essentially, both the fear response and the feeding response can't exist at the same time, and this is known as reciprocal inhibition. One example of this includes a scenario in which a rat becomes fearful when looking at a realistic photograph of a cat. When the rat is constantly being given food in the presence of that picture, its fear will decrease until its fear response that was originally seen is gone. It is important to notice that although the rat had been conditioned to relate that picture of the cat with fear, the way it responded to being fed wasn't compatible with the response to fear. A more general proposition was proposed by Wolpe, in which he basically said that the relation between a fear and the anxiety that tends to appear can be weakened only if a response that prevents anxiety can take place while in the presence of any type of stimuli towards that fear. He also noticed that the way humans react to anxiety-induced situations is very similar to the reactions he saw in the animal lab. So the concept of reciprocal inhibition could be used to treat human disorders. When working with people, the anxiety-inhibiting response that was used was deep relaxation rather than the rat situation where they were being fed. Again, this was done based on the idea that one positive and one negative response can't be experienced at the same time. In this case, those two responses were deep physical relaxation and fear. Wolpe believed that people had phobias because certain things that were learned during their lives through classical conditioning became known in their brains as fear-causing things. As seen in Wolpe's study, treating phobias requires people to experience positive responses that help to prevent fear and/or anxiety while they are experiencing their feared situation.
In Wolpe's article, there were 39 different cases of various phobias, and how Wolpe determined whether it was successful or not was based off of the patient's reports. 91% of the patients reported to be successful. Whether it was a complete success or a partial success, they all had great improvements. But as far as the 9% that was not a success, Wolpe attributes that to a different circumstance that made desensitization impossible in that case.
Psychotherapy desensitization has grown in use and is now considered the treatment of choice for anxiety disorders, especially phobias. A study by Paul, based on Wolpe's work, treated college students who suffered from extreme phobic anxiety in public speaking situations. This was tested through randomly assigning participants in 3 treatment groups: systematic desensitization, insight therapy, and no treatment. Participants were then asked to give a short ad-lib speech to an unfamiliar audience, and their degree of anxiety was measured by observers' ratings, physiological measures, and a self-report questionnaire. Results showed that systematic desensitization was significantly more effective in reducing anxiety on all measures, and improvements are still happening in a 2-year follow-up for 85% of the group. Wolpe's work was also used in another study by Fredrickson in developing a new treatment strategy for negative emotions such as anxiety and depression. In his proposition, he states that teaching patients with such psychological problems would generate stronger and more positive emotions. Through this, positive emotions are cultivated and would counteract negative emotions. Another article that was based on Wolpe's work was by Zettel, who used systematic desensitization to help students overcome extreme levels of math anxiety. They were then asked to develop an 11-item math fear hierarchy, such as being called by the math teacher to solve a problem at the blackboard, and the hierarchy was presented to each student. At the end of the study, results revealed that 11 out of 12 students displayed recovery or improvement in their levels of math anxiety, and it was maintained during the 2 months of follow-up. According to Wolpe, increasing measures of exposure to a feared object may lead to the gradual disappearance of fear. An example of this is a child who is about 13 years old and has a phobia of dogs. This could be the result of a frightening experience with a dog when they were younger, such as being bitten by the dog or having a parent who is very afraid of a dog. These experiences would develop an association between dogs and fear. So, in order to break the association, people would suggest to get the child a puppy, and that is a form of desensitization.
Hello, my name is Michelle, and I'm an expert in treating phobias. Today, I have 3 special guests that I'm going to be interviewing so that we can learn a little bit more about their phobias.
Hi, I'm Diana.
Nice to meet you, Diana. Can you explain some of the symptoms that you experience with your fear?
I can't even go near small spaces. I can't. I have to run away from it. I can't be there.
You know what that sounds like? That sounds like claustrophobia.
Oh. You know, I was hiding in a closet one time and I couldn't get out and it was really tight.
Hello, what's your name?
Hi, I'm Joyce.
Nice to meet you, Joyce. What are some of the symptoms that you experience with your fear?
Well, I hate knees. Like, I actually really hate them. Even if it's your knees or my knees, I can't stand them.
That sounds like genophobia. When did you realize that you had this fear?
Well,
Oh my gosh, stop. Your
Bro,
knees are
they're
literally
so extravagant.
Bro, I've never seen such
Joyce,
big
look
knees.
at our knees.
no, stop.
Our knees are so... Is she okay?
It started when I was in this PE class, right? And we had to change and all that stuff. And then I just saw people's bare knees and they looked so weird that I just faint or just panic.
That's so sick. Hello, what's your name?
I'm Landon.
Nice to meet you, Landon. Can you explain some of the symptoms that you experience with your fear?
Well, I really don't like the tall green things that are outside. They really scare me.
You mean trees?
Yeah.
That sounds like dendrophobia. When did you notice these symptoms start to develop?
I was in art class and I was painting a tree and it scared me.
Now we have our 3 interviewees here, and we're going to talk about ways to treat your phobias. So the main thing that will help you guys to treat your phobias is to face them head on. So for you, going towards smaller, tight spaces, and for you, maybe appreciating your knees a little bit more, and for you, going towards trees and looking at how beautiful they actually are.
Yes, I am hopeful for today. Take this music and use it. Let it take you away and be hopeful, hopeful, and he'll make a way. I know it ain't easy, but that's okay, 'cause we hope.
Relaxing your fears away.